Empowerment is really important with nurses, but especially in the emergency department.
The excitement, you never know what's going to walk through those doors.
A big chunk of that is a focus on education, but also just as important is the focus on that individual.
As a nurse, I feel like I'm part of the team. Doctors listen to us, we listen to them.
Eskenazi Health is driven to train and retain compassionate caregivers. It's part of the culture. Emergency nurses feel like a family and work like a team, and that strengthens the mission. For emergency nurses, it's more than a job.
They are called to work here. The mission at Eskenazi, I think, is what draws the majority of us to come here and to then stay here.
The mission of Eskenazi Health, it's really to advocate, care, teach, and serve. And as we apply that to the emergency department, we have a very vulnerable population of patients, really underserved people. Part of our job is to advocate for them, to teach them how to take care of themselves and how to get the follow-up care that they need. It's really about serving those in the community.
Saving lives is the big part of it. I love our patient population. Every day's a new day.
You never know what's going to walk in through the door. Gunshot wounds, strokes, heart attacks.
Responding to the daily challenges requires a supportive culture.
The staff that we have here become your second family.
Everyone here on our management team started out here. We worked on the floor here. We began our nursing careers here and have just grown together.
Career growth opportunities and continued education helps retain staff and increases the pipeline of new emergency nurses.
We tend to hire nursing students and we hire them in as care techs.
We keep about 50 care techs on. They're all part-time employees. That makes life a little easier to schedule around school.
They spend a year and a half with us while they complete their nursing education, and then we hire them as graduate nurses. So we're kind of recruiting our own to fill our open RN positions, so there's growth opportunity in that way.
Being a patient care tech here at Eskenazi has got me acclimated to the environment and the flow of the emergency department. Rather than being a new person in a new place, learning a new job, it's helped me out a lot.
It's a lifelong learning department, and that's what I love, is that you can always learn something new every day.
The faculty and staff that make up Eskenazi Health as a teaching facility have also learned, particularly how to help frontline staff deal with the stress and complexity of the job.
Emergency nurses often see patients and families on some of the worst days of their life.
Violence has been difficult for us. It seems to have ramped up post-pandemic. People are more irritable, easily angered.
We have panic buttons implemented throughout our emergency department. We have security that are with us in our stations at all times.
We're working on some new de-escalation training for our staff.
There's also debriefs for the inevitable tough days.
Being in the emergency department, you do see the worst of the worst. We've implemented debriefing sessions, which does help.
Those can be started by anybody, a staff nurse, a pharmacist, the physician staff.
Space to de-stress and re-energize is set aside too.
The recharge rooms, the staff love those.
It's about remembering the emotions of the emergency nurses doing the work and supporting them when the difficult situations of that work slows down.
There's recharge rooms with drinks, there's the common grounds, there's music therapy, and there's pet therapy. Almost on any given day, you'll find a pet therapy dog in the organization. What we're doing at Eskenazi Health in the emergency department is developing the nurses of the future.
And moving them forward in a modern, state-of-the-art emergency department.
I think it makes the nurses' attitude even better. If your nurses are happy, then generally your patients are happy too.
We feel very heard here and empowered by the collaboration that we have, and it's really important because it's for our patient care, not just for us.
What excites me about the future of emergency nursing is the technology evolving that can make our job easier. I don't really know what the future holds, but I'm excited for it.
Emergency nurses of the future makes me excited. I hope that they enjoy doing what they do as much as I have.